You get done from work and head straight to workout. You don't take the time to warm up, and everything starts to hurt. What do? You keep going, pushing through, and end up injured, twisting your knee, rolling your ankle, and you still have to go to work tomorrow.
Welcome back to Mobility Agility Chiropractic Performance. Today, let's talk about how we recover from pain and injuries. Do we use heat? Do we use ice? Do we rest? What do we do? In 1978, Dr. Gabe Merkin coined the acronym RICE for the treatment of musculoskeletal injuries. RICE stands for rest, ice, compress, and elevate. This was developed around our biggest concern at the time, which was to manage the symptoms of an injury, pain and swelling. There was little concern for the long-term outcomes and how this would ultimately affect the healing. Within the medical field, though, approximately every 10 years, our understanding changes with the research, which is why RICE eventually changed to PRICE. The addition of the P was for protection, which was added for acute injuries to add bracing. The goal of protection is to prevent further injury and potentially allow for return to activities before complete healing, when it's necessary, such as when having to return to work. Otherwise, it may require complete immobilization. In 2010, it changed again, where PRICE lost the R and added an OL, making the mnemonic police. This change was for optimal loading, which came with the understanding that the body heals better with controlled stress and movement, so that long periods of rest would cause loss of range of motion, function, and cause fear with avoidance of injury. Understanding how we really came to heal caused this change. And then additional questions came out. Why aren't we recovering faster? Why are we still getting injured? What's going on? So then we had to change the mnemonic again. And I'm not going to say this is the final change because who knows where it's going to go next. But this is where we learned that tissues heal with loading, and the mnemonic became peace and love, which stands for protect, elevate, avoid anti-inflammatory modalities, compress, educate, load, optimism or a positive outlook, vascularization, and exercise. Now, each one of these points is covered more thoroughly in our blog, so you can kind of see what they all mean and how they benefit you into healing. We've now covered the history of how we have changed our treatment recommendation. Now let's talk about when to utilize ice and when to utilize heat. Ice has really been moved into the emergency medical realm of pain management. It's a great alternative to opioid medications. It truly is one of the best pain managers, and within minutes of an injury, it is a great option for keeping you from going into shock or reducing the pain enough for you to return to play. But 2 days later, it's really not a great option for just pain management. It can be used to reduce pain if you're going to utilize rehabilitative exercises. Now, this utilization of ice is really concerning acute traumatic injuries, not chronic musculoskeletal pain. Chronic musculoskeletal pain can develop after an injury that occurred many months to years ago and really can be caused by spasming of the muscle. Adding ice can make it feel better for a short period of time, but will actually cause the muscles to tighten down further and increase the pain and dysfunction. So that ultimately will make it worse. For these chronic musculoskeletal conditions, it's important to utilize heat. Heat can be a better option for managing this chronic pain. And with that, if you really don't know which one to utilize, ask a trained medical professional which would be better. Because ultimately, we're just trying to get your pain managed so that we can load the injury appropriately to get you better faster and assist with tissue remodeling. Now let's look at some simple exercises you can start off with to begin the healing process so that you get out of pain faster.
Just a quick heads up. None of the activities should be a sharp or stabbing pain, but a dull ache around a 2 to 3 on a pain scale is okay to continue. Let's start with the shoulder. We're going to move through different ranges of motion, activating both the muscles in the back and moving through ranges of motion that can be uncomfortable, such as internal rotation of the shoulder. These exercises help warm up the muscles that need to be utilized and should be done for 5 to 10 repetitions before combining them for strength exercises to stabilize and prevent injuries. The CUBAN press is a great option for creating stability for different overhead activities and exercises while maintaining strong shoulder strength. They can be used both to grow muscle and stabilize the shoulder. Next, we are going to focus on the knee, starting with the simplest exercise, the quad set. These start waking up the big muscles in the front of the leg. Next, the straight leg raise is utilized to really activate the quad muscles and decrease knee pain right at the kneecap. Once activated, it's important to stretch these muscles actively through a range of motion. This can easily be achieved non-weight bearing using a slider. Each exercise should be done 5 to 10 repetitions. Our next area of the body is the ankle. A good way to warm up and work on range of motion is doing the ABCs, working at full range to draw out each letter all the way to Z. This exercise works on ankle dorsiflexion, or the ability of the knee to move past the toe while the heel remains on the ground. It's important to do this both before and after exercise, 5 to 10 times. Our next exercise is to warm up or cool down the low back. It involves twisting in a controlled, dynamic way to help stretch the area without causing any pain or tension. The goal of the exercises that we've shown so far is so that you can get into the gym, get onto the court, and really get back to doing what you want to do, whether that's lifting light, going and playing volleyball, hitting the ice and skating, whatever activities that you're interested in, being able to do those to your fullest ability without risking injury is what our goals are.
I hope this helped clarify how to manage pain and injury. If you have more questions, please comment below or check out our blog. And until next time, remember here at Mobility, Agility, Chiropractic Performance, we strive to get you better faster and keep you better longer, because no one has time to be sidelined.
To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.